I'm Dr. Kavita Ratnalingam, Consultant Rehabilitation Physician at Region Rehabilitation. We're talking today a little bit about orthogeriatric rehabilitation, which is really orthopedic problems or problems affecting the bones, the muscles, the ligaments, the tendons in the geriatric population. I guess the most common would be hip fractures. As we get older, more so in women, there's osteoporosis and the risk of fractures become higher. Very commonly, it's caused by a fall. And so when we look at the rehabilitation process, we usually see the patients after the acute care, after surgical stabilization, and the patient comes to us for rehabilitation. It does need to be an interdisciplinary program, or it works best, we get best outcomes with an interdisciplinary program, which includes not just the rehabilitation which looks at goal attainments on function, mobility, but we also need to look at things that cause the fall. Were there medications that made the patient drowsy? Were there medications that made the patient feel lightheaded and caused the fall? Was it factors at home? Poor lighting, carpets, obstacles caused by the placement of furnitures that caused the fall? Or does the patient have balance problems? As we get older, our muscles tend to get weaker, we have more difficulties with balance, and this predisposes a person to fall. And so the part of the rehabilitation program also needs to look at not just strengthening bone, but also muscle strengthening and balance activities, because the last thing we want is a second fall. So that would probably be, hip fractures would probably be the most common condition that we have or we treat in rehabilitation.
Okay, role of therapy in orthogeriatric is multiple uses we can do in many different cases. Because patient comes, ortho means it's actually orthopedic. Anything you do with bones, fractures, muscles, it all comes under ortho. So our patient can come to us maybe after a total hip replacement. Fractured hip, they can come. So we have a protocol for them to follow. That's how the healing will. So the patients must follow the protocol in order to get better, strengthening exercise and all that. Or patient might come to us after a total knee replacement. Nowadays, arthritis, osteoarthritis of the knee is so common. Patient goes for replacement. After that, they don't know what to do because it can be very painful and they are so scared to do exercise. The important about this knee replacement, hip replacement is the exercise. The post-op is the most important. If they don't do properly, they will end up with contracture. It doesn't serve the purpose of doing the surgery. So that's why they need to know what's the protocol to follow. Can be done anywhere by any therapist. So what our region is, because we are focused, we make sure they get the 3 hours, and then the protocol we told the patients how to do it. So when we explain to them and patient understands, they will get healed faster, they're going to walk. Our aim is to get them functional as soon as possible. It can be very painful. So we also will do on the pain management. Doctors do give medication, but there are other means like ice therapy is one of the most important to relieve the pain. Hot pack is important. So we tell them after exercise, put the hot pack, that relieves their pain. We have other modalities to help them. So it can be upper body fracture. Like anybody just had a fall on an outstretched hand, they will get a fracture on their collis. We call it collis fracture on the radius. Then they can't use the hand. They can't use for a lady just to put a bra will be difficult. Then we have to get the occupational therapists to teach them. You can't use one hand, how to do it in one hand. So if nobody teach them, they're going to be suffering in silence now. Every time I want to wear a bra, I need to call someone. Every time I want to wear a dress, I need to call someone. But once we teach them what to do, they're so happy. I'm functional. I know how to use only one hand and I do all this thing. The minute we teach them how to walk and even need to transfer a car, they are so happy. Yeah, I still can go out. Even I got a fracture, now I can go out. So this is how the role of therapists in orthogeriatric. And patients come with, well, I always call them, they come with a package. They just don't come with a fracture. They have heart issues, they are diabetic, they are hypertensive, some of them got other issues, or they already been suffering in pain, or some of them already got some muscle wasted. So a lot of things has to be done before actually, of course the goal seems to be so easy, just to get the patient up and walking, but it's not as simple as that. If your muscles are not strong, you can't stand up, and there's more danger of you falling down because muscles are not strong. So you have to make sure we strengthen the muscles accordingly, then we get them to do things safely. So this is where when we work as a team, everybody works towards the same goal and patient gets it. And it has to be explained and to be educated. All patients need to be educated and advised and how to do it safely and easily at home. So whatever we teach in the hospital should and must be transferred to their home environment, and they should be able to carry on. Some patients after discharge, they come as outpatient. The one who really can't come, we make sure they know how to do this exercise at home safely. That is orthogeriatric.